Hello and welcome to Vaccinate India in partnership with Google, a program that's very important to all of us. In fact, this program also lies at the heart of what our partners Google want to share, the critical need to ensure that millions across India vaccinate and protect ourselves, our families, our friends. In the course of this program, we'll be sharing basic information with you. The fight is to battle COVID together, but specifically we have three areas we intend to focus on this program. The Delta Plus variant, what we know of it so far, the uptick in vaccination, it's been a great week for that, and the sudden rise in cases in Maharashtra. Why exactly is that taking place? But as always, let's take a look at some of the important details that Google actually has. So a lot of people want to know statistics about vaccines, where we are in India in terms of vaccination. So coronavirus vaccine statistics, if you were to just type that and different variations of this on the search engine, then you actually get a lot of detail, as you can see over here. It's interesting to actually know where we are at a global level. Remember, this is a global pandemic, 288 crore doses given all over the world, and the percentage of the population of the world fully vaccinated stands at 10.4%. Now compared to that, India isn't doing very well at the moment. We're only at 3.9% of our population fully vaccinated. And this needs to be upped, right? We need to be reaching 100% of our population, in other words adults at the very least, being vaccinated. Now that doesn't compare favorably with, say, the United States, which is at 46.2%. And remember, these are countries where people aren't wearing masks anymore. They've been cleared not to. Let's give you a few more details on what we can actually give you. This is interesting because this is actually showing the uptick in vaccination in India. So while the overall numbers are only recently getting better, which is a great thing, the base was actually really low. It's starting to go up, and it's only in the last couple of days that we're getting these large number of vaccinations which are taking place. So you can actually click over here and see how over a period of time what exactly is happening with data as well provided. So on the 15th of June, with at least one dose, we had 15.2% of our population fully vaccinated at 3.5%. So this has gone up, and you can actually see 23rd of June, 17.5% have got one dose, 3.8% has gone up. Now this has gone up to 3.9%. So it's that fully vaccinated number, the second number, that we actually wanted to look at. And that's so very important if we are to actually win the fight against COVID. So let's take a look now at some other details which we are looking at. Now the real worry in India, and it's a variant of concern, is the Delta Plus. The Delta Plus has got an additional mutation in addition to what we've seen in the previous Delta variant, which is now there in several countries in the world. And this is the split of cases all across the country. As many as 20 cases being reported in Maharashtra. Maharashtra believed to have perhaps the most accurate reporting thus far of COVID cases in the country. Now we are talking of COVID Delta Plus, so that's a big concern. Why do we have these cases, and how much more infectious is this Delta Plus? Now on our special programs, we've actually been told by the government that Delta Plus is not necessarily it may not necessarily result in a third wave, which is great news, but it is a cause of concern. We need to keep vaccinating a lot more in order for this to be sorted out. Maharashtra we were looking at, and what we've actually seen is this is when Maharashtra reached its peak approximately on the 14th of April, after which it started going down. Now these were Delta cases, but again it's starting to plateau the 27th of June. And what we are trying to do is to see whether why is this no longer going down? That's what we are trying to understand. Why is this no longer going down? Why is it curving in this direction? And that's a cause of concern. We don't want it to go up. So that's a big worry over there in Maharashtra. We'll try and understand what exactly is happening, where some of the areas are. The total vaccine shots given in India, as you can see, this has been quite encouraging. It's been this sizable uptick over the last few days. There was that one day when we had that record, but the total vaccine shots given 32 crores, and the 7-day average. So this is going to be a program on a week which is particularly good, 60,27,046. is the 7-day average, because we've had that incredible spike actually in one of these days. As you can see, this day over here, we had that incredible spike on this particular day. But let's take a look now at a few more details. And this is the bottom line over here. And we keep revisiting this data because we actually need to look at this data very, very closely to see where exactly we are. Now, 183.8 doses are left in order for 2 people to get the doses. So that's the first number which is so very important over here. The number of doses given so far, 32.2 crores. The current average, and as again, it's been a good week, the 7-day average stands at 64.38 lakhs. Now, what is our target? Our target is actually 98.3 lakh doses a day. So that 64.38 has to go up to 98.3 lakh doses. That's what the big concern is, that are we actually moving at a pace we need to? So while, and the target is the end of the year, the end of December, we need to have vaccinated all adults. That's the government's target. The time it will take to vaccinate all adults at the current average rate, 9 months. Now, we don't have 9 months till the end of the year. In fact, we've got only 6 months and 3 days. So you can actually look at this from a different standpoint. You can say that, you know, a 3-month delay isn't all that bad. But if we are actually trying to vaccinate all adults, we need to aim for that 98.3 lakh doses every day, So that's what India is actually trying to do at this stage. Well, joining us, Dr. Srinath Reddy. We are also joined by Dr. Shashank Joshi and Professor Sanjeev Krishna. I'd like to thank you all very much for being with us. So, Dr. Joshi, let me come to you first. Let's talk about the Delta Plus variant. Now, our goal, of course, is to prevent COVID, and therefore, my first question is, what do we know about the Delta Plus variant which makes it a cause of real concern for us?
So, Vishnu, we know little about Delta Plus. Delta Plus, 40 cases have been reported from India. These are from the genomic surveillance. A large bulk of these cases come from Maharashtra, mainly from Ratnagiri and 4 other districts. Whatever little we know, these samples were collected almost 2 to 4 weeks back, and except barring 2 deaths, one in Madhya Pradesh from Ujjain and one in Maharashtra, mild to moderate disease has been reported, and almost all these cases have been recovered. But because of the UK and Nepal data, which is AY1, we know 3 things on the Delta Plus segment. The first thing which we know is that this variant probably is as transmissible as Delta. Number 2 is that we also know from the UK data that it has an affinity to the lung ACE2 receptor. And number 3, we know that it may bypass the efficacy on treatment of the monoclonal antibody as well as the vaccine. Okay. So these are the 3 things known from the UK data.
All right. Okay, 1 second. So I just wanted to go across to, I want to go across to Dr. Srinath Reddy. Dr. Reddy, now if we look at COVID symptoms, what do we know about the Delta Plus variant and the symptoms which present itself?
Well, as of now, the number of cases is too little for us to say that this is the classical picture. At the moment, it does appear to be like COVID, but much more of the lung being affected. But we'll still have to wait and see till larger number of cases come in. With 40 cases, we ought to really not jump to conclusions that this is going to be the behavioral pattern. Yes, we do know about the structure. We know a little bit about its behavior, but not enough. So I do not think we can really say that this is going to be a much more virulent virus. Right now, there is no information anywhere from the world suggests that this is going to be a much more virulent virus. We'll have to definitely gather the data and then analyze it. And of course, the most important element to look out for is potential vaccine escape or evasion. Even that we have to watch out for and test as well.
Okay. Professor Sanjeev Krishna, if we talk about vaccine effectiveness, and here in India we are talking about Delta Plus, do we believe that the vaccines which we have right now will be as effective?
Thanks for having me, Vishnu. Overall, I think the message is very clear. Vaccinations are still critical. Vaccinations are maintaining efficacy for the large part when it comes to reducing the risk of severe disease and hospitalization. And we must not forget that this is really, really important good news. There are some other features that we know about vaccinations now. Some of the symptoms that patients develop with SARS-CoV-2, including the Delta variant, may change compared to those who haven't been vaccinated.
Yeah.
So, you may end up with a headache and more sneezing and more runny nose compared with the more lung-based symptoms.
Right.
But overall, the vaccine efficacy to prevent hospitalizations is still there. You need 2 doses, and you need maximum immunity achieved, within the limits of when you need to vaccinate.
Yeah.
And after that, there is an effect.
Yeah. So, Dr. Reddy, my next question to you, in India by now we would have a lot of real world data on effectiveness of a single dose of AstraZeneca. I ask about a single dose because in as much as we want 2 doses, we've increased the gap between the dosing. Now, a lot of people have concerns about that. I think you have a concern about it as well. But isn't there real life data to suggest that even with 1 dose of vaccine, people are quite well protected with Covishield at the very least?
Well, in terms of real life data, a number of hospital series have been reported suggesting that people who have received in a single dose vaccination have been fairly well protected against severe disease and death, though many of them could have also had a mild infection. It has not always been correlated with the genomic analysis of the variants. Therefore, we cannot swear that this is really true of the Delta variant in terms of the large enough number of cases being analyzed. But it does appear from whatever hospital data are available in India that we are going to see, even with a single dose, some level of protection. But whether that's going to be adequate for the most vulnerable sections of the population, who are the aged and those who have severe comorbidities, and whether they should actually be given some priority at earlier vaccination at 8 weeks rather than wait for 12 to 16 weeks, that is a matter to be decided, and that I believe the expert committees are looking into it.
Right.
But certainly we must not downplay that even a single dose and certainly 2 doses give you reasonable protection even against the Delta variant.
Sure. Dr. Joshi, we've seen an uptick in numbers in Maharashtra in the last few days. I won't say that the curve is going back up, but is this a matter of concern? You've also had more Delta plus cases. This isn't to suggest that all of those cases in the uptick are necessarily Delta plus, but are you seeing certain trends in Maharashtra? I ask in the context of people saying that the second wave isn't quite over. I ask in the context of people saying that a third wave is just around the corner.
So a couple of things. I don't think there is a correlation with that little surge which has come back directly proportional to the Delta plus. I think as we eased out restrictions, we saw overcrowding, congregations, lack of COVID appropriate behavior. And still, whether independent of the strain, we cannot afford to not adhere to COVID appropriate protocols and behavior. So that is going to universally be there till we don't vaccinate 70% of our population with vaccine, which you rightfully alluded to. So till we don't get our 2 shots, for the next 3 months, we need to be on vigilance. See,
so
there is no need to
prevention,
panic.
what you're saying, absolutely key, and that goes beyond just vaccines, right?
So you are right, but I think, to some extent, we have to be very, very cautious even on this Delta plus because we don't have data on it. And Delta or Delta plus, both are variants of concern. Though I personally, from my personal take, this is more of a Delta minus from whatever little data we have. And we need more.
Why do you say so, sir?
Because, it could be a variant of interest. Currently, whatever little 20 cases we have seen, most of them with mild to moderate, most of them have recovered well. Unless and until there has been a comorbidity, senior citizens, we have not seen that. But as I said, the data is too small. We have better data available on AY1 from United Kingdom, and they have not suggested the same. Okay. So I think till we have more data to say that this is a more deadly strain would be inappropriate. At the same time, we can't be off guard because in the second wave, we clearly saw that wherever we erred and we delayed and deferred, we actually, it exponentially spread. Right. And any Delta related variant has a high transmissibility. Their R0 is definitely more than 3.5, which is the normal R0. And that is why you are absolutely right. when you say that Maharashtra has to be vigilant, and despite of many states like North India have completely seen the complete decline of the second wave, Maharashtra has seen a surge from 6,000 cases per day. We have gone up to 10,000 cases per day.
Yeah.
And that is a cause of concern for us,
Sure.
which is why you have seen that now no district in Maharashtra is allowed to go above level 3. And if they have to go above level 3 to level 2 or level 1, then, you know, rapid antigen test related test positivity has to be more than at least 2 weeks below 5%, and 70% of the population needs to be vaccinated.
Okay. Dr. Krishna, you know, now in the United Kingdom, we're also seeing obviously the spread of Delta. Are you seeing it having that same impact in hospitals where, you know, people needed a lot of oxygen, where hospital beds were being completely loaded, or are you actually seeing an uptick, but an uptick which is relatively under control? Why? Because you've seen a large amount of your population being vaccinated. Vaccine effectiveness being the key issue.
Yes, that's a key question. And our confidence day by day increases as the data start to come in. And
vaccine effectiveness, yeah. Go ahead.
Yes, the confidence that's building up tells us that there is now a separation between cases, so those that are diagnosed as being positive and those that need to come into hospital for one reason or another. And it is usually those that have not had a full dose of vaccinations or a single dose. So now we're seeing the younger age groups, those that are less prioritized for vaccines in the early days. They're the ones that are more susceptible. But it is reassuring that there is this difference now between cases and hospitalizations, because that very much supports your suggestion, which is that the vaccines are still effective, including against the Delta variant. And it also really pushes for your encouragement that we need to increase, at least in India, as you've pointed out, you know, by about 30%, I think you're highlighting the daily vaccination rate.
Correct.
So that it's taken up and it starts to have effects. And at the same time, again, let's not forget all the other measures for COVID appropriate behavior while the vaccines are being rolled out.
Yeah. All right, I'm going to take a short break. Come back with you, gentlemen, in the next few moments. Do stay tuned. Welcome back. Well, let's just briefly turn our attention to what more needs to be done to ensure we get to our target vaccination group. Dr. Reddy, you know, a lot of new vaccines are going to be coming online very soon. Novavax, the Johnson & Johnson vaccine, perhaps our own Zydus Cadila vaccine. So how would you respond to those who are actually saying, you know, can one choose one's vaccine? Is that something that people should be encouraged to do, or you should just go and get whichever vaccine you want?
Well, we now recognize that it's the government that's going to be supplying most of the vaccines.
I can't hear again.
Whether it's going to be through a central distribution channel or through the states, and it's only going to be some element of private purchase by the hospitals and the large-scale private employers who will gain access to vaccines of their choice,
right,
beyond what the central procurement is. So those who are actually getting vaccines free when delivered by the central government or the state government agencies will not have any choice really, because the logistics of supply to different vaccination centers will be streamlined according to that. It's only people who are going into the private sector, to the hospitals, where they may be able to get, based on their choice, they may be able to choose the hospitals which have procured some vaccines which are available in the market. So I don't think it's entirely possible that for an individual, because even the logistics of supplying multiple vaccines to a single vaccination center will not be efficient.
Yeah. Dr. Joshi, what do we need to do to, you know, to go beyond that 80 plus figure which we managed on one odd day? We need to keep going up at this stage. It's in an infrastructure nightmare, isn't it?
I think it's an issue of how many vaccinations we can do. Operationally, we can easily cross 1 crore a day. So India has the infrastructure and ability to do that. The current challenge was supply, and I am given to understand from sources in Government of India that in another 2 to 4 weeks, we will definitely be in a much better situation than what we are today. So from 60 lakhs to 80 lakhs, from 80 lakhs to 1 crore looks to be feasible. And we will also have in another month's time, another 3 or 4 vaccine manufacturers having their vaccine in place. We'll have the Zai COVID in place. We'll have the biological events in place. We will have Indian-made Sputnik also available. So when we will have a larger number of vaccine players as well as larger production by the 2 main manufacturers, which is Serum Institute as well as Bharat Biotech, I think we will be able to reach a crore a day. It is not impossible. But I personally feel that by first week of August, we will be at the peak of our vaccination, and August and September are going to be the key months where our vaccination program, if it is able to meet 60 crore vaccination in these 2 months, I think we will be in a much better shape for handling any further wave or a so-called wave.
All right. Well, I'd like to thank you all very much for joining us. After months of complaining about vaccination and saying it wasn't in the right direction, I honestly think that we are perhaps getting there. Maybe another month or so, vaccine availability will be sorted out, and then we need to just keep vaccinating. It's not bad, it's improving, and that's a big deal. Out of time on this program from all of us here.